Hello, Mia. I'm so excited to have you here and that you'll be commenting and talking about what is so important about the mouth health, oral health, dental health, and how it relates to bone health and how the osteoporosis drugs may impact bone health, osteonecrosis. So I'm going to ask you if you can introduce yourself and tell my audience who you are. I will say how delightful you are, but tell us who you are and how you came to the mouth.
Hello, Irma. Thank you for making this possible. I feel really honored and I must say comfortable. I'm a long-living plant with a few careers in my luggage. So my first half of life was pediatric dentistry and preventive dentistry, teaching and working and mentoring in university settings for almost 20 years, from early 90s to mid 2000, when I've decided to settle in Canada to live with my family in Montreal. And over here, I reached out for the preventive part of the dentistry, which is my real passion, and it's my life philosophy.
So we have many people in my community that are in the phase of getting surgery, oral surgery done, perhaps an implant. And then the question is if they're going on a bisphosphonate or an anabolic, is it okay to do it before? Should they wait until they can't always wait X amount of time before they go on the medication, but should they take the medication first and then wait on the dentistry? This is a big question. So that's one question that I wanted to ask you. So let's talk about the medication. Yes.
Well,
Well, let me ask you this before
yeah,
we go. Have you seen a lot of osteonecrosis?
to be honest, I've seen maybe two.
Two in your 35 years?
Yes. But bear in mind, I'm a pediatric dentist. So when I was seeing those, it's because when I was collaborating with maxillofacial surgeons, probably they will tell you a completely different thing. But I've seen that firsthand. Yes, it doesn't look pretty. The thing is that today you have, we have actually means to do our oral surgeries in a way that's least traumatic, as we say, compared to some time before, from biocompatible materials we're using, with the degradable materials, which are only there during the healing time, and with implants that have advanced in their technology of biointegration, osseointegration in the last 15 years, more than ever in the entire history. So now we can literally, we're able to guarantee that they are going to be there for life.
So
I lived through that, through implants which were not being like, they were almost like a lottery, when if they stay, to implants which can be put in any kind of mouth. Today, thanks to that, there is a little bit of controversy. You have a lot of surgeons who are saying, don't stop your biphosphonates, alendronites, everything you're taking, don't stop it, because to me, it's important that you are good. Don't stop blood thinners even. We're going to do the surgery, you're going to heal, we're going to follow up. There are factors for sure that we cannot encounter and which are intrinsic for the body. And then sometimes we can go into that, if there is a lot of inflammasomes, if there is a lot of reaction of the immune system, we can end up with an infection that it's very hard to heal. So, but much safer than ever before.
So the implant posts, is it titanium that you use only?
Oh, no. There are many elements over there. There are alloys which are even superior to titanium. They're going to the details of their design of their threads and how the neck is designed so the attachment happens. The thing is that it was by chance discovered that the bone will grow with that one. And Brennemark found that just examining something completely different. And that is just jumped on it and said, this is for us. So they put it, and it's fantastic. It's really important to see the entire mouth, lifestyle, habits, attitude of the patient. That's, for me, that's the most important thing. Indication is number one, and patient has to be informed to the detail that the patient can understand, accept, and decide about.
Well said. So having said all of that, Mia, do you offer consultations to people?
Well, it depends on what subject. I have a large library of first-hand information, which I can sift and interpret. My core understanding is in prevention. So my core knowledge and expertise in prevention, which means prevention in a sense of preserving health, in reclaiming health, and also with dealing, I'm dealing with people who have different systemic diseases and special needs and everything. So if it's about the surgery, if it's about the indication of something, I'm able to explain every part of the treatment plan.
So if somebody were about to go into a procedure, it's possible that they could reach out to you and say, what do I need to ask my dentist?
Oh, for that one, what do you need to ask your dentist? I could help. And if I cannot right away help, I promise I'm going to find a good source and get back to you as soon as possible.
So Mia, how do people get in touch with you?
So thank you for asking how people can best contact me. I think the email is the best mean because I'm really eager reader. I answer all my emails, and it's in the bottom of this page.